Okay, here we are. From a good clinical practice represents an international standards of ethical and scientific quality for the design, conduct, and registration of clinical trials involving human subjects. Adherence to these standards of good clinical practice publicly guarantees not only the protection of the rights, safety, and well-being of the subjects participating in the study, in accordance with the principle established by the Declaration of Helsinki, but also the reliability of the data collected. The specialized practice of the CRN, clinical research nurse, therefore comes to include 5 domains: the protection of the human subject, the coordination and continuity of care, clinical practice, the contribution to science, and the management of the study. The involvement of the CRNs in research was associated not only with improved quality of clinical cares for better effectiveness in communication between clinical staff and participants, greater number of subjects recruited, and greater patient adherence to study procedures. Although it has been widely demonstrated in the literature that the clinical research nurse plays a fundamental role in conduct of clinical research, and despite the need for nurse figure in research context is supported by a code of ethics, DL-IFA and GCP, the role of research nurse doesn't yet have an internationally agreed standard definition. Failure to recognize the professional identity of the research nurses leads to a discrepancy between the centrality of this role within clinical trials and the professional consideration by other members of the research team, as well as by the nursing community, and the lack of clarity regarding the training necessary for this professional specialization determines the lack of opportunities to career development, with the consequent inadequate remuneration. The objective of this narrative review is to determine strategies that can promote recognition of the professional identity of the CRN within the research team by analyzing criticalities and impediments at an institutional and regulatory level. The research was conducted following the following question formulating through the PIO. What are the critical issues, obstacles, and barriers to the recognition of the professional identity of the CRN, and therefore to the achievement of a greater job satisfaction? A review of the international literature was carried out by consulting biomedical databases such as PubMed and CINAHL, limiting the search to articles from the year 2005 to 2020. The PICO framework was specifically built to answer the research question. The bibliography research was conducted through the construction strings adapted to the various databases with variously combined mesh terms. 6 studies were included in the final analysis. Of the 6 studies, 5 studies were qualitative and 1 study was cross-sectional. The results: a general lack of understanding of the CRN role by both the nursing community and other healthcare professionals was identified, defined as professional role ambiguity, and this resulted in a negative impact on care for the CRNs surveyed in the studies of the patient, on job satisfaction, and on the management of clinical study. Lack of specialized professional career path with adequate institutional and economic recognition, as the CRN interviewed in the study expressed dissatisfaction with the opportunities to progress in terms of career advancement and regarding the inadequacy of remuneration, despite the need for skill advanced to fulfill this role. Difficulty in relating with colleagues shared by all the CRN interviewed, as the lack of understanding and recognition of the role of the CRN, due both to a lack of a basic training on clinical research and to an unstructured career path. has determined in the study examined difficulties in professional relationships between the CRN and fellow nurses dedicated to the general care in the hospital operating units. In daily clinical practice, in the ambiguity of the CRN professional role created a friction between CRNs and colleagues that not employed in research, who had negative attitudes toward research in general. Furthermore, the CRN involved in the analyzed study reported feeling invisible to colleagues in the clinical community, isolated and excluded from larger nursing group due to the ambiguity of their professional role, the type of solitary work, invisibility of research and work objectives, sometimes very dissimilar from conventional nursing care outcomes. Finally, the need for post-basic specialistic training has emerged, since although high specialized skills are required to practice the CRM profession, basic university education and standard nursing practice provide a little research training. And as a consequence, studies covered by this literature review revealed the shared difficulties across all studies in transitioning from clinical nurse to clinical research nurse specialization, regardless of professional background and seniority. The purpose of this literature review was to determine the strategy to promote a recognition of the professional identity of the CRN within the research team, and consequently a greater job satisfaction through the analysis of the critical issues that hinder the affirmation of a recognized professional identity. To this end, it is proposed to introduce the clinical research nursing in basic academic training through clinical internship in order to have a greater understanding of the role by the entire nursing community. The obligation of post-basic specialistic training as a necessary requirement to operate in the field of clinical research, and consequently the determination of opportunities and well-structured and defined career paths, which allow adequate remuneration for the skills required by professional specialization. Finally, while in the USA, the American Nurses Association has formally recognized clinical research nursing as a full-fledged nursing specialty, the profession of the CRN in Italy is very little still known at the present, and research nursing are often present only in scientific hospitals. The nursing role in clinical research in Italy is widely underestimated and has yet to establish a clear identity and position in both within the research teams and in the nursing community. Today there is a lot of confusion regarding the responsibility of the CRN. At a legislative level, there is no recognition and there is no specific job description for the research nurse. In fact, the activities that the clinical research nurse carries out in its daily practice vary depending on the research center in which the CRN operates. Is very different from the center. In conclusion, it is considered desirable to involve both professional association and governmental institution in the recognition of the clinical research nurse for his management and leadership skill in clinical trials, and the institutional recognition of the clinical trials through strategic and financial support from organizational leadership. Thank you so much for attention.